Health experts in Nigeria have called for increased taxes on sugar-sweetened beverages in an effort to reduce consumption, which has become a source of concern to public health. And this was as they met in the nation's capital, Abuja, where they revealed that high intake of sugary drinks is responsible for the increasing number of non-communicable diseases, which has been identified to be responsible for the increasing number of deaths in the country. Marvelous Obomanu has details.
This gathering is made up of stakeholders from Nigeria's Ministry of Health, policymakers and civil society organizations working around public health issues and policies. They say there is a need to reduce excess consumption of sugary drinks, as data available reveals that the consumption of sugar-sweetened beverages increased by 72% in Africa between 2008 and 2022. They also add that consumption in Nigeria increased by 123% during the same period. While Nigeria introduced a tax of 10 naira per litre of non-alcoholic carbonated and sweetened beverages on June 1, 2022, to reduce obesity and other health-related concerns, this has not achieved much results.
More than 30% of all deaths in Nigeria are linked to non-communicable diseases. It is alarming. And according to WHO, the risk of premature deaths from cardiovascular diseases, cancer, respiratory diseases, and diabetes, among others, of people between 30 and 69 is about 22%. As of 2020, about 21 million Nigerians were overweight, 12 million obese, and in our population of about 15 and above.
Even if the amount is increased or not increased, what is important is health promotion and health education. If an amount is increased, let's say even 30 naira per litre, some people have the money to afford. But if people know the effect to their health, whether it is even free, people will decide on what to do.
Health, they say, is wealth. At this conference, made up of stakeholders in the health sector, they are calling on imposition of tax on sugar-sweetened beverages as a way of reducing consumption, as it is linked to non-communicable diseases. Beyond taxation, in a cash-strapped economy like Nigeria, stakeholders are saying it will serve as a revenue earner for the country.
The tax reform that should be done relating to excess-based tax public health is to have a sustainable policy law like other government that will ensure that SSB are taxed to that tipping point that will cause reduction in consumption.
They also add that there is a need to increase the sensitization of the effects of sweetened beverages on the public, as records reveal that even children are not left out.
Children are coming up, adolescents are coming up with diabetes, coming up with cardiovascular diseases, coming up with cancers, coming up with a lot of avoidable non-communicable diseases. Like I said, the country is tilting towards a double-burden country, in which case the non-communicable disease is also competing with communicable diseases.
Marvelous Obomanu reporting for News Central.